Hello, my name is Erin. I'm with Servion, here to show the COVID-19 vaccine scheduling solution using the all-new WebEx Contact Center and how it allows your patients to automatically determine their own eligibility and schedule their own vaccine appointments. The native integrations with Google Dialogflow powers this solution without putting strain on your agents. To start, we have a chatbot integrated into this mock NJVSS website. This is an easy widget that can be added to any website as needed, and the WebEx Contact Center is a really flexible solution that we've stood up for this demo as an end-to-end product. So we're going to be looking at these interactions through the lens of Jane Doe. She falls into the 1A grouping as a 65 plus citizen. Going to try and schedule an appointment. Can I schedule a vaccine appointment? And this conversation is starting with a virtual agent that will first try and determine Jane's eligibility. And we've of course based this on the requirements for the 1A group. So frontline worker, that doesn't apply to Jane, but the 65 plus does. This is her first shot, not her booster shot. And her zip code is 08810. And notice how I'm keeping the language very casual, it's very natural, and the bot is still able to pick up on the inputs that Jane are putting in. So my date of birth, you can tell that she definitely falls under that 65 plus with that birthday. And now that it's done collecting some of the information for Jane, notice how it is giving some information while Jane is going through this process. So be sure to bring your license or ID and have your name match that when we're putting this information in. And now it's done a number of things in this message here. First, it's taken the zip code that Jane put in and actually selected the vaccination center that will work for Jane. Another thing it's done is pulled from a demo database that we've set up and gotten the available times. So what we can do at this point is integrate into an API to pull that data. So we have a partnership with SpinSci in order to pull this data from Epic. And so we have the ability to really take full advantage of the modular system of the WebEx Contact Center to really make this solution very flexible to your needs. In this case, Jane will select Monday at 10 a.m. And now that we have that appointment scheduled, we have the option to now get those confirmations sent automatically by the system. So first here, we'll confirm an email address to have that info sent. And we'll show Jane's inbox after this interaction. And now it's asking if Jane would like to receive that information to her phone via text. That text is pretty immediate, so I'm going to drag over Jane's phone. And so once I put in Jane's phone number, you'll see it come up on the right-hand side. And as you can see, that text has been sent successfully. We've now effectively allowed Jane to determine her own eligibility, schedule her own appointment, and get her own confirmation numbers and details without ever having to engage with an actual agent. Notice how we're not putting strain on the patient. We're not stressing the patient out. The patient is able to use very natural language, follow through this process very easily. And now, at the end of this conversation, after Jane's done everything in self-service of herself, we can now close that feedback loop by providing Jane an opportunity to fill out a very brief survey. So let's just show that. We've kept it very simple in this context, but again, these can be changed to fit your needs specifically. And now that we've reached the end of the survey and the end of the conversation with the bot, there really aren't many other features that this bot can provide. And so it is asking if we want to talk to a specialist specifically. This is to really show that at any point during this conversation, we can escalate this interaction up to an agent if necessary. And that's a seamless transition if that's something that would be beneficial or needed for the system. But what I want to emphasize here is this is truly end-to-end automation without the need for agents to get involved in this process. But if necessary, what we can do is just hit that yes. And what I'll do is go over to the agent desktop to show you that chat coming in on the agent side. So like I mentioned before, that interaction comes in seamlessly. I can see the entire history of that interaction when I scroll up. I can also see the contact history, see that Jane has actually reached out before with this email address, as well as chatted in before. But like I mentioned before, I can clearly see that Jane has already done everything that she could through the bot without ever having to interact with me as the agent. I also want to go over to Jane's inbox to show you that she has that COVID-19 vaccine appointment confirmation in her inbox, just as we saw with the text message as well. And what I now want to do is demonstrate this on the IVR side. So what I'm going to do is bring Jane's phone back over where she has the vaccine registration number open. So we'll see this call being made. Again, the IVR being powered by that Google Dialogflow, that native integration allows Jane to determine her eligibility, schedule an appointment, and get that confirmation without ever having to engage an agent, keeping the language very natural and making it very easy for Jane as well. We don't want to strain the patient or make it a stressful process for them either. So we're going to start that conversation and you'll hear both ends on the call.
Welcome to New Jersey Vaccination Scheduling System, NJVSS. How can I help you today?
Can I schedule a vaccine appointment?
I can help with determining your vaccination eligibility now. Are you a first responder or healthcare worker?
No.
Are you 65 years of age or older?
Yes, I am.
Have you ever been vaccinated for COVID-19 before?
No.
In what zip code do you reside in the state of New Jersey?
08810.
Thank you for confirming your eligibility. The nearest vaccination facility in Middlesex County is at the NJ Convention and Expo Center. Please select either Monday, February 24th at 10 a.m. or Tuesday, February 25th at 10:30 a.m.
Monday the 24th.
Sorry, could you say that again?
Monday at 10 a.m.
You have successfully scheduled your COVID-19 appointment on Monday, February 24th at 10 a.m. at the NJ Convention and Expo Center. Your confirmation number is 13680. At the time of your appointment, please bring your confirmation number and identification. Would you like for me to text you your confirmation number?
Yes.
Is the number you are calling in from the one you'd like to receive the text?
Actually, no.
What is the number you'd like to use to receive that message?
201-293-6049.
A text has been sent successfully. Please remember to wear a mask at your appointment and practice social distancing. We've value your experience. Are you interested in participating in a feedback survey now? This will take 2 to 3 minutes of your time.
Yeah.
Please answer each of the following questions with either yes or no. Did you find all the information you were looking for today?
Yes.
Please answer each of the following questions with either yes or no. Did you find all the information you were looking for today?
Yes.
Would you recommend the NJVSS to others?
Yes.
Thank you for your feedback. Is there anything else we can help you with today? If yes, I can connect you to a specialist.
Yes.
Thank you for contacting the NJVSS. Please wait while I transfer your call to a specialist.
And so we can see that call coming in on the agent desktop. We've got a number of screen pops coming up, but let me close those and go back over to the agent desktop so you can see what it'll look like when that call comes in. So I've got the information pulled by the IVR displayed on my screen. But really what's more important here and what I really want to focus on is if you do need to have that information sent over to the agent. The agent has full visibility on that interaction in the WebEx Contact Center. So I can see the exact verbiage that Jane used to get to this point and the path that she took with that IVR. So in either case, I have full visibility into that, but really, as you heard on that call, Jane did not need to have her transfer to an agent in order to get the eligibility determined, to schedule that appointment, and to get that confirmation sent to her phone, which, as you saw pop up and probably heard interrupt the IVR, as you can see, that text message got sent over to Jane's phone. So she has all the information that she needs. And she was able to really do this on her own, again, without having to strain herself. There were a couple of times that I needed to repeat it, but it's just because I have my phone on speaker so that we can all hear it. So my mouth is a little bit far from where the microphone is. But regardless, you were able to see how easy it was for me to make that appointment, to get that confirmation, and to really have this experience without ever needing to reach out to an agent. What I want to finally point out here is that the system is very flexible, as I mentioned before. It's pulling the information in regards to which slots are available through the modular system of the WebEx Contact Center. Because there's that flexibility there and these native integrations, it really allows us to create a solution that really fits your business needs. So we can have these APIs pulled, as I mentioned on that chat interaction, powering both the chat and these digital channels, as well as the IVR on the voice channel. We can also add an automatic booster shot appointment as a follow-up to that initial shot. As you saw in both interactions, it's clarifying whether this is that first shot or a booster. And we can also expand the eligibility criteria as the next phases for vaccine deployment reach the general public. The WebEx Contact Center is also a no-code, low-code setup. So what this really means is that we can deploy this very quickly and very effectively, and because it's a cloud-based solution, we can really scale this up as well. I'm really happy I was able to show you the solution. Thank you so much for your time. Look forward to connecting.